foyer. Obamacare does none of this. The facts and figures tell it like it is. President Obama tells it like it isn't. It's time for Congress to tell it like it is and repeal Obamacare. Thank you, Mr. President. I yield the floor.
Senator from Nebraska.
Mr. President, thank you. I had an opportunity during the comments of my colleague, Senator DeMint, to sit here and listen to those, and I would like to start my comments today by complimenting Senator DeMint. Those were very, very thoughtful comments. Mr. President, many of my friends on the other side of the aisle are now acknowledging the problems with the health care law. It was a fascinating process last September and October as we were leading up to the November elections to see members running to be on the other side of the aisle and saying, well, I would have done this different, and if I get there, I'll do that different. We've already seen one such provision designated for repair is my legislation to repeal the 1099 reporting mandate that is in the legislation. Now, Mr. President, just to be clear, I've never argued that that was the start of the unraveling of the health care bill. I don't believe that for a moment. What I would say is this: that provision should have never been in the health care law. I'm very, very pleased to report today that that legislation, after 2 attempts to try to get it repealed, now has the support, bipartisan support, of 61 senators, and the President mentioned repealing this provision in the State of the Union address. While there is bipartisan agreement on this provision that it needs to be taken out and repealed, the rest of the 2,700-page bill is bursting at the seams with flawed provision after flawed provision. Months and months ago, as this bill was making its way forward, each one of us individual senators had an opportunity to decide, can this bill be changed enough to be saved? And the conclusion I reached is that there were no amendments that could change this bill enough that I could ever support it. It's fatally flawed, and you just can't repair the problems. The catchphrase these days, the catchy slogan is that we will repair this bill. Well, this bill is beyond repair. You can't tinker around the edges. You can't just kick the tires and put some air in them. A good detailing job on this bill won't save it. Even a major overhaul cannot get this bill back on the road. It needs to go back to the factory, Mr. President. This bill is a lemon. It's simply beyond repair. That is why it's important for all of us to support Senator McConnell's amendment to repeal the health care bill in its entirety. Let me just start out and say what courts are now acknowledging. This is an unconstitutional piece of legislation. The underlying foundation of the health care law is predicated on a false premise, that the Constitution somehow allows us here in Congress to demand of every private citizen that they buy a government-approved product or face penalty. Let me repeat that. The premise of this legislation, the false premise, the unconstitutional premise, is that somehow we as elected representatives possess the constitutional power to force every individual in America to buy a government-mandated and approved product or face a fine. And that is an unconstitutional premise. Recently, this fundamental flaw was exposed by court rulings in Virginia and Florida, As a lawyer, I've read both of them, first word to last word. Just finished reading the Florida decision yesterday. These courts, in thoughtful opinions, found that this so-called individual mandate was simply unconstitutional. Judge Vinson, in his Florida ruling, said this, and I'm quoting, "If Congress can penalize a passive individual for failing to engage in commerce, the enumeration of powers in the Constitution would have been in vain, for it would be difficult to perceive any limitation on federal power, and we would have a Constitution in name only," unquote. You see, according to Judge Vinson's ruling, the entire health care law is unconstitutional because it is predicated upon the individual mandate. President Obama has argued that. Members have argued that on the floor. And now there's this attempt to extricate from that argument, and it just won't work. The law will continue to be debated in other courtrooms, but I believe we are looking forward to a day when the Supreme Court of the United States says to Congress, "You went too far. You went beyond the Constitution of this great nation." However, the health care law is flawed even beyond this congressional overreach, this unprecedented congressional overreach. The health care law double counts dollars, threatens the health care infrastructure of this great nation, and adds more individuals to a system that I'm very familiar with as a former governor, the broken Medicaid system. There isn't a governor in America that would come before any hearing of Congress and argue that the Medicaid system is anything but broken. This bill is also paid for by over $500 billion in tax increases and over $500 billion in real cuts to Medicare. Now, regardless of the claims to the contrary, Medicare cuts simply can't be counted twice. They cannot simultaneously reduce the deficit, extend the solvency of Medicare, and then pay for this open-end entitlement. Well, I'm sure any American out there would see the fallacy of trying to say to them, well, you can spend the same dollar twice. You can, on one hand, pay for your mortgage, and on the other hand, use the same dollar to make the car payment. You know, no American would believe that. You see, only in Washington could you get away with such Enron-type accounting. It is simply budget hocus pocus. Even the administration's own CMS concludes that the law's Medicare cuts, quote, cannot be simultaneously used to finance other federal outlays and to extend the trust fund, unquote. I've long made the assertion that if Congress makes reductions in the Medicare program, then those dollars need to stay in the Medicare program to shore up a program that is running out of money, not to pay for a new health care entitlement. Instead, here's what we end up with. These cuts to Medicare are going to have long-term consequences to seniors' access to physician and health care services. Let me focus on my own state for a moment. Nebraska home health agencies under this bill, in just 5 short years, 2/3 of our home health agencies will be operating in the red. Nebraska nursing facilities, already stretched to the limit, will have to endure $93 million in cuts. Anyone want to argue that isn't going to force the closing of nursing homes in Nebraska? Of course it will. Hospitals and hospice, major reductions in funding. 35,000 Nebraskans who like and receive the advantages of Medicare Advantage are going to see reductions to their benefits. If Nebraskans are going to endure these cuts and others across the country do the same, they should have at least the security of knowing that the sacrifice they are being asked to endure is going to improve the Medicare program. If all the tax increases and all the Medicare cuts weren't enough, the law's projected cost completely ignores the $115 billion it will cost to implement this legislation. Now, around here, billions of dollars are thrown around. We all of a sudden, in the last 2 years, added new words to our vocabulary, trillions. You know, a program just isn't big enough unless it's got a $1 trillion price tag anymore. Well, let us remind ourselves that those are hard-earned dollars by somebody out there trying to make a living. This isn't about funding trillion-dollar programs. This is about poor individuals in this nation who are struggling to get by, nearly 20% of which are underemployed or completely unemployed. All these hidden costs will drive up the price tag even more of this very ill-advised statute. However, one of the most troubling aspects of this so-called reform is its massive expansion of Medicaid. It simply heaps more unfunded mandates onto state budgets. And as a former governor, I don't know how governors are doing it these days. They are in a financial meltdown with few exceptions. And here we are, simply heaping more unfunded mandates onto state budgets that are already crumbling. It puts, get this, it puts 16 million more people on the most broken part of the health care system, Medicaid. I can attest to the challenge of trying to provide quality health services for those on Medicaid today, not even addressing the millions to be added. Even now, our offices are flooded with frustrated individuals completely unable to find someone to provide health care services to them due to the lack of participation in the Medicaid program. You see, the story here is this: 40% of doctors don't take Medicaid patients. Why? They can't afford to. Ask any doctor, any hospital administrator in America, could you keep your office or your hospital open on Medicaid reimbursement? And they would laugh at you. They would say, absolutely not. We would go broke. And so what's the government's solution to that problem? Add $16 million on a broken system. It is not because they don't want to treat these patients, you see. They do. But the Medicaid reimbursement rates would drive them into bankruptcy. So instead of dealing with that problem, a very serious problem in terms of access for poor people, what do? We burden our states with additional costs with this legislation. We saddle them with little flexibility through maintenance of effort mandates and totally disregard the big question of how all these new eligible individuals ever have a chance of finding care. According to a recent study, the Medicaid expansion is going to cost Nebraska between $458 million and $691 million over 10 years, depending upon participation rates. More shocking is that almost 1 in 5 Nebraskans will now be forced on Medicaid, a system where we can't find them care. And we're not unique. This is the true story in every state in the United States. The impact on this Medicaid expansion could be profound to many hospitals because Medicaid-eligible individuals who are unable to find primary care, and there will be millions of them, will turn to the emergency ward for their care. Recently, the Centers for Disease Control reported detailed statistics on nationwide emergency room usage. While only 14.1% of all hospitals in the U.S. had Medicaid coverage, Medicaid patients comprised more than a quarter, 25.2%, of all ER visits nationwide. This preliminary May CDC report confirmed that the uninsured don't visit the ER most often, contrary to the arguments made on the very floor there that I am standing. This preliminary May CDC report confirmed that the uninsured don't visit the ER the most often. Patients with Medicaid do. Specifically, more than 30% of Medicaid patients under 65 visited the ER at least once, compared to fewer than 20% of uninsured and those with private insurance. An ER physician put it best, quote, "High utilization of the ER is no surprise. Many patients have difficulty finding primary care providers who take Medicaid, so the ER is the only alternative," unquote. And so what does this new law do to solve this problem? Nothing. It exacerbates and exaggerates and compounds the problem. And I could go on because the flaws in the law are so abundant and so severe that it can't operate. Mr. President, let me wrap up with this thought. The people of America deserve better than this effort. The people of America deserve something better than an unconstitutional attempt to say the federal government knows better than you. No mechanic could get this jalopy running again. They'd just scratch their head and say, haul it to the junkyard. This health care bill is so fatally flawed it can't be fixed. The only option, contrary to what happened a year ago, is to go back and in a bipartisan way work to build solutions to the health care challenges a step at a time for once and for all, instead of compounding problems, solve them. Mr. President, I yield the floor.
The senator from New Jersey.
Here, the requests of people who are on the other side of the political aisle here to repeal a health reform bill that has been put in place, received majority support in the House and the Senate when developed, and now what we are witness to is that within a bill that's planned for the continued support for the FAA, takes care of the conditions with which our aviation structure works, that there's an amendment put in here that says that we want to recall the health care bill, the health reform bill that was signed into law by the President of the United States. And we've heard that there are challenges in the court, but we hear also that there are verifications in the courts that say this this act does appear to be constitutionally sound. And I'm listening here, and my vantage point, Mr. President, is that I grew up in a very poor, working-class family with all of the ills that follow poverty. And I see America through that kind of a prism. And I see an America that's intention is to be fair, to take care of our citizens, to provide them with services, to make sure that we have military forces to protect us from enemies, to make sure that we have some labor standards that try to make conditions healthy for working people so their health is protected as they perform their tasks. There is an implicit promise that says we're going to educate those in the early years, for sure, with reasonable education. In other words, there's a distribution of the assets that this country of ours holds to which almost everyone is entitled to. We're not talking about differences in income or differences in personal material, housing, etc., that some have that others don't have. I'm not talking about that. I'm a capitalist. I came up the capitalist ladder working hard. I'm going to talk about that in a minute. So when I listen to the rhetoric that's delivered here on a continuing basis about government interference in keeping people alive, in keeping people healthy, why should the government interfere with people's chance to be overcome by illness or injury? I consider it an outrage that some of our colleagues want to repeal a law that is designed to improve the lives of millions of Americans. The push to repeal health care reform, I think, is the worst kind of hypocrisy, coming from this place and at the other end of the Capitol. Here we're 100, the other side has 435 people. There are those who have voted not to have this health care reform in the first place, and now those who are jumping on the opportunity to repeal a law that is designed to help people health, to help kids grow healthfully, to help families be able to maintain a degree of functioning when illness strikes their family, to provide services that increase longevity to our people. And I, for one, speak well for that effort. It's so hypocritical to me because the senators who are advocating repeal have access to the best health plan in our country. They get it, walk down the hall here. There's a clinic, half a dozen doctors, competent, skilled people. There are health care aides who work there, professionals. And all you have to do is go in there and say, Doc, I feel something here, or I feel something here, or I've got this swelling here, or whatever. And you get care. And we pay for it. Not a lot, but we pay for it. But it's available. It's available. It's a kind of a perk that I'll call it, that people across this country would be astonished to see how well we treat those who make the laws in this country, those who have the responsibility of taking care of our people, our constituents. They'd be astonished to see how easy it is. You go into the clinic and, yeah, we'll take it. Listen, you need some surgery, and we'll get you over to the hospital in short form, and we're going to take care of this before your disease gets the better of you. When people hear senators, congressmen, staff people get sick, they just have to walk down the hall to the Senate physician's office. Don't have to get in a car or anything like that. They don't know the worry or understand the worry that comes if medical bills overtake the opportunity to buy food or housing or even force people into bankruptcy. Again, let me say this isn't simple rhetoric for me. I lived through these conditions. And yet, these people who are up for repeal are fighting to take away the lifeline the health care reform law has given to families in need. I know firsthand what it's like when your family doesn't have access to basic health care. I grew up in a family of modest means in Paterson, New Jersey. It's a mill town. It was typically a city that received immigrants on a regular basis. My father spent his short life working in local silk mills, and he died of cancer at 37 years of age when I was still a teenager. My dad was 43. My mother was 37 when she became a widow. I joined the Army. I enlisted in the Army. I attended college under the GI Bill. I was a soldier, served in Europe during World War II. And as a consequence of the opportunity that I had to get an education, I was able to join a couple of friends and start a company that is known across the globe. The company is called ADP. We have more than 40,000 people working around the world in more than 20 countries. 3 of us from poor families. 2 of them are brothers. And their father was a mill worker also. And because of the success I had in business, all my family had to do was worry about their good health and not backbreaking medical bills. But I never forgot what it was like to see my mother working so hard behind the counter of a store to pay the doctors, the pharmacies, the hospitals, to keep my father comfortable for the 13 months he was in bed with cancer, robbing him of his life on a daily basis. And that's why I was proud to vote for the historic health reform law, which is holding insurers more accountable and making our system more sustainable. I look at the history of the health insurers, and because we see the health care bills constantly taking more of the GDP, but you wonder where the health care cost increases take place. But I looked at some of the companies. For instance, I took the year 2009. It was a tough year for lots of people, lots of bankruptcies, lots of foreclosures, lots of jobs lost. 2009, Cigna did $1.4 billion 5 years earlier, and about the same in 2009. The company CEO got $18 million worth of salary, providing a commodity service. Humana, in 5 years, went from $270 million worth of revenues to $1.3 billion. The CEO there got $66.5 million. United Health, they had a heck of a 5-year period. They started off with $2.4 billion worth of revenues in 2004, and in 2009 it went to $3.8 billion, from $2.4 billion to $3.8 billion, and the CEO got $9 million salary, but he got big kickers at the end of the year. Company called WellPoint, they did, in 2004, they did $960 million worth of sales revenues, and 5 years later, they did $4.7 billion. CEO there got $13 million. And I look at that, and as we ponder where the money has gone to pay for health care in this country. So I see one place that a lot of it goes, and that is to the insurance companies. And now, some of our colleagues want to recall this bill, remove the health care protection from 30 million Americans, 30 million people across this country, almost 10% of our population will lose health insurance care if we repeal the bill that's in the works, that's now on in place, the law. The fact is, repealing the health reform law would be an enormous step backward for our country. It would hurt seniors, it would hurt children, small businesses, and our deficit would balloon, grow larger. Repealing this law would raise drug costs for seniors by removing from them a 50% discount on drugs that they purchase when they're in the period of the donut hole, and which also will, by the way, this law will help prevent us, removal will help prevent us from totally closing that donut hole. Seniors across the country, listen to the truth about what's being said. The donut hole is going to be closed. It's roughly a $4,500 element in people's incomes, or costs, rather. This repeal would also give the biggest insurance companies more power over their patients to charge outrageous fees than ever before. It means the insurers could once again reduce benefits, stop coverage during a person's illness, and refuse to care for children, individuals and children stricken with pre-existing conditions. Repealing health reform would also hurt young adults who would no longer be able to stay on their parents' health plans until age 26. For young adults, especially new college graduates facing a tough job market, staying on a parent's health insurance is the only reasonable priced insurance option available. If health reform is repealed, small businesses will lose tax credits for up to 35% of health insurance premium costs. It would jeopardize the recent growth in the number of small businesses offering health insurance coverage to their employees. And this repeal effort is fiscally irresponsible because ending health reform would increase the deficit by at least $1 trillion, increasing the deficit. We're all now here looking at the deficit and wondering what we can do to bring it under control, but we can't do it with the costs that we have now scheduled for health care.
How much longer he would be on speaking?
About 3 minutes.
Thank you.
As a country, how could we repeal this law and look at our children and grandchildren, look them in the eyes? We should be focused on getting this critical jobs bill signed into law, not refighting last year's partisan battles. Make no mistakes, Democrats are willing and eager to fix the parts of the health reform law that might need adjustment. I, for one, would salute that kind of a review. But to repeal the entire law is an example of outrageous overreach. Instead of meeting us halfway, our colleagues on the Republican side are engaging in, I think, misguided political battles. It's wrong. We can't allow repeal of this law, which is improving the lives of a million Americans. And I thank my colleague from Arizona for permitting me a courteous extension to the time that I had.
Mr. President.
Senator from Arizona.
Thank you. I thank the senator from New Jersey, and I ask unanimous consent to engage in colloquy with the senator from Wyoming, Senator Barrasso.
Without objection.
I thank you, Mr. President. Obviously, we rise in support of the amendment put forward by the Republican leader for repeal of the bill, of the health care bill. As we know, the House of Representatives has already acted in overwhelming fashion. And neither the senator from Wyoming or I intend to go through all of the arguments that we went through for nearly a year here on the floor of the Senate. The years that I've been here, I've never spent that much time on any single issue by far than on the health care issue on the floor of the Senate. But one of the most important parts of this debate has been the overall cost, either savings or lost, if this legislation is repealed. And of course, the highly regarded Congressional Budget Office has determined that there would be an overall increase in cost of health care in America if the bill were repealed. And I think it's very important for us to recognize the valuable work that the Congressional Budget Office does. They are really one of the most important parts of the decisions that we make on legislation. But I think it's also very important to point out that the Congressional Budget Office makes decisions directly related to the input and the parameters and the details of legislation and how they are sent. The Congressional Budget Office, most appropriately, does not decide on policy. They are simply there as a budget office. So what I'm saying is garbage in, garbage out. If you are given certain data base to make judgments of cost on, then of course you are going to come out with basically predetermined results and analysis. So one of the numerous aspects or parts of the legislation that was not taken into consideration by the Congressional Budget Office because of the way the legislation was written is the so-called doc fix. Now, the doc fix, as we all know, is in compliance with a reduction in Medicare payments to doctors, which was mandated several years ago. And then we found out that doctors would stop treating Medicare patients if they were deprived of the Medicare payments that they needed in order to make up for the costs of the treatment that they provided to Medicare enrollees. So here we have taken out of, and we know that every single year we have had the quote, as we call it, the doc fix, which has not allowed the previously legislated reductions in Medicare payments to physicians. So that's an additional $208 billion over 10 years. That alone, $208 billion. Nowhere is that put into the equation. Then we have, of course, the so-called Class Act. a poorly designed federal long-term care program, and it was inserted at a point in the debate that was never in the original bill which was passed through the Help Committee. And it raises taxes by over 500. I'd ask my colleague, it is a program for long-term care that people pay into the system in order to be eligible for long-term care benefits, but over time, that money comes back out, not in the time frame that was given to the Congressional Budget Office. Now, there are a number of other provisions. I'd ask my colleague from Wyoming about what his assessment of the costs were, taking in consideration the Doc Fix, the Class Act, the envisioned Medicare cuts by $500 billion, and others, which simply are not going to happen. And I would be interested in your total of the costs that actually would be saved by the repeal of this legislation.
Because what we're trying to do is actually provide people with the care that they need, the doctors that they want, at a cost they can afford. And yet when we look at this health care law that, remember, was written behind closed doors in spite of promises, I mean, that's why people were so offended by this and why people still opposed to this. It, written behind closed doors, votes in the middle of the night, all sorts of different special deals cut for senators to get to that 60th vote. And then, and what I hear most about as I travel around my home state are the cuts to Medicare, the proposed cuts to Medicare. As you mentioned, $500 billion. You talk about the President having a commission to look at the debt. What that commission said is, if you're going to take money from Medicare, which this law does, takes $500 billion from our seniors on Medicare, it doesn't do it to help strengthen Medicare or lengthen the life and the vitality of Medicare. It does it to start a whole new government program. So it's $155 billion from hospitals, $202 billion from the 11 million seniors on Medicare Advantage. It takes $15 billion from nursing homes, $40 billion from home health agencies, $7 billion from hospices, and as my colleague from Arizona said, he gets to the Class Act, which has been called a Ponzi scheme that Bernie Madoff would be proud of. The President's own debt commission says repeal that, because there is no way, with the way that that is set up, in terms of taking the money in first so they can count that as coming in, but the obligations to the country 10 years and beyond will bankrupt this country. Everyone on both sides of the aisle realizes that. The bipartisan President's Debt Commission realized it, to the point that they actually put in one of their recommendations. But now to hear our colleagues and the last speaker talk about the fact that this may actually help with the deficit and with the debt, anyone who looks at this over the long term and the nature of our country knows that this is going to bankrupt the country. I worry about the jobs in this country, 9.4% unemployment. As a senator, I know both of us as senators are working to try to find ways to make it easier and cheaper to create private sector jobs in America. This health care law makes it more expensive and harder to create private sector jobs in this country.
Nowhere during the debate, I'd ask my friend, did I understand that there would be a really very large use of, quote, waivers to different companies, unions, businesses, et cetera. And already we've had well over 700 waivers granted to unions and others who have sought relief from this legislation. Now, I'm told that that only entails about 1% of America's economy, but isn't that quite a remarkable repudiation of this legislation? I would have liked to have heard during the debate. And by the way, the Secretary of Health and Human Services is going to have to give well over 700 waivers for people so they won't have to comply with this law. And obviously the only reason why you give a waiver is because the law, implementation of the law, would be harmful to them. I'm very interested in hearing my colleagues' comments about this so-called waiver business, and along with that, the governor of my state has written to the Secretary of Health and Human Services to give the state of Arizona a waiver. I hope that since the Secretary of Health and Human Services is in that business, that she will grant it to my home state.
I'd like to see every citizen in this country have a waiver. I'd like to have every state have an opportunity to have waivers, because just last week the Secretary of Health and Human Services gave another 500 new waivers, a total now 729 waivers. You can find them on the Health and Human Service website. This covers 2.2 million people. Now, it's interesting because in this debate, before this bill was passed through in the middle of the night after being written behind closed doors, labor unions publicly supported this health care law. Well, now there are 166 union benefit funds who are exempt. They got the waivers. They got the waivers. Unions now have 860,000 of the waivers of the 2.2 million waivers. So unions now have 40% of all the waivers, even though there are only 7% of the private sector workforce in this country. So my question to my colleague is, if this law is so good, why do so many people who supported it in the first place now say, I don't want it to apply to me? Is it as Nancy Pelosi said when she was Speaker of the House before the election that repudiated this health care law and the way it was crammed down the throats of the American public? Didn't Speaker Pelosi say, well, first you have to pass it before you get to find out what's in it? It seems to me, and I'd ask my colleague from Arizona, that as people know more and more about what's in this law, it is less popular on a daily basis, to the point that yesterday 58% of Americans in a Rasmussen poll said that they would like to have it repealed, and the numbers of people that thought that all of us ought to be able to get waivers was even higher than that.
Well, I want to thank my colleague for his enormous contribution to this debate and his knowledge and background in the medical profession. There's just one other issue very quickly I'd like to mention, and that, of course, is that I was very pleased to hear the President of the United States at the State of the Union message say that we ought to look at the issue of medical malpractice reform. I can't tell the number of times we have tried on this floor to have at least a beginning of some kind of meaningful or any kind of medical malpractice reform. And I said to the Secretary of Health and Human Services at a hearing the other day that I hope that she would be making some proposals to us, to the Congress, so that we could obtain some kind of medical malpractice reform. As we all know, sometimes as much as 20 to 30% of the cost of health care is accrued because of the physician's prescription of unneeded, unwanted, and unnecessary tests for fear of the physician finding him or herself in court trying to defend a treatment of a patient. And that, of course, is a huge portion of the additional costs in health care in America today. So I was very pleased to hear the President of the United States say that he wanted to examine and visit the issue of medical malpractice reform, and I know my colleague stands ready to work with him on that.
The President said the same thing in June of 2009 when he visited and spoke at the American Medical Association. So when that issue didn't really come to the fore, as a number of us would have liked it, in this health care law that was written behind closed doors, they asked Howard Dean, who had been chairman of the Democratic National Committee, why they didn't include it. And he said, well, we just can't stand up to the trial lawyers who have such a remarkable influence over the party on the other side of the aisle. So I'm hoping that the President, in his statement in the State of the Union, is sincere, because it clearly didn't follow through what he said in June of 2009 when he met with doctors from all across the country.
I thank my colleagues. I thank the Senator from Maryland for her patience, and we yield the floor.
Mr. President.
Senator from Maryland is recognized.
Mr. President, I rise today in very strong opposition to any attempt to repeal the health care reform bill. The Republican leadership has offered an amendment to repeal the Affordable Health Care Act. Now, Mr. President, they're only keeping half of their promise. They went out there and campaigned, and the Tea Party had a teapot boiling over, and they said, we're going to offer a bill to repeal and to replace. Well, guess what they're doing here today? One more hollow, symbolic, pander to the masses amendment. Their amendment offers a repeal, but it does not offer a plan or strategy to replace. Because you know why? They have no ideas. They just want to pander to the crowd. Now, I want you to know I am emphatically and unabashedly against the repeal of health care reform. But I'm going to say to my colleagues as I listen to this colloquy, every senator has the right to rewrite legislation, but they do not have the right to rewrite history or to rewrite the facts. I heard CBO criticized and be dismissed, but yet it was the Republican Party that said we couldn't move anything, bring up anything, even go get a Kleenex without getting a CBO score. Now, they don't want a CBO score, so you can't say I want a CBO score one day and then make fun of it the next. Garbage in, garbage out. Then second, oh, they rewrote the bill. They wrote the bill in the middle of the night, sweetheart deals and whatever. I was on the Help Committee. I chaired the task force on quality. I went to several hearings in an open, public forum to get the best ideas to produce the best bill. In many of those instances, very few of the other party even bothered to show up. So I'm not real excited about their criticism. Then we went into a markup of the bill. 4 weeks in the Help Committee. Open, public markups in full view and on C-SPAN. Over 300 amendments were dealt with. 300 amendments. How is that secret? How is that behind closed doors? How is that in the middle of the night? We worked in the middle of the night because there were so many amendments. Fine, that's democracy. That's the way the legislative process works. But don't try to rewrite history. Don't try to rewrite facts. And if you want to rewrite the bill, keep your promise, Miss Republican Party, that if you want to repeal, then let's go to replace. And I want to hear their ideas for replacement. I challenge them right here, right now, today, on this amendment. Come in with other amendments on your ideas for replacement. I want to know what it is that they want to do. I want to know which parts of the health care reform do they want to repeal and replace. What is it that they want to repeal and replace? How about this, that no longer big insurance can deny coverage to a child with a pre-existing condition? Do they want to repeal that? And what are they going to replace it with? Do they want to repeal the part where we allow young people to stay on their parents' plans until they're 26? Do they want to repeal that? And what do they want to replace it with? We eliminated the caps on health care, a cap on what an insurance could pay out. Do they want to repeal that cap? If you have cancer, if you needed heart surgery, and what are they going to replace it with? I'm proud of what we did in health care. It's an excellent bill. We accomplished 4 goals. First of all, we saved and strengthened Medicare. We did end those punitive practices of insurance companies. We expanded universal access. And guess what? We came up with quality and prevention measures that save lives and save money. This is what people wanted in health care reform. I heard it all over Maryland and heard it in hearings. I had roundtables, hearings. I was in diners. I held online town hall meetings, phone calls, letters. And once they got the straight information about what we did, they like it. Last year, let's go to Medicare. We extended the solvency for a decade. We closed the donut hole that's been so hard to swallow. Last year, more than 32 Maryland seniors received a $250 rebate check to help pay for prescription drugs. That's in the health care reform bill. If we repeal it, do I have to call up 32,000 Marylanders and say, give it back? Give it back? We repealed? Wow, I bet that's going to go over. These same seniors will now get 50% off of their brand-name drugs when they hit the prescription drug coverage cap. Are we going to repeal that? And what are we going to replace it with? But also, one of my favorite parts of this bill was ending the punitive practices of insurance companies. Seeing a child denied coverage because of chronic conditions like asthma or juvenile diabetes. I also fought very long and hard, as everyone knows, for women. Did you know, Mr. President, that when we began our hearings on the bill, we found out that in many instances, insurance companies charged women 25 to 40% more in their premiums simply because they were a woman, more than guys with the same age and the same health status? Are we going to repeal that and bring back gender discrimination? Also, we ended the despicable practices of just being a woman being treated as a pre-existing condition. Another thing that my hearing disclosed, in 7 states and the District of Columbia, women were denied coverage for simply being a victim of domestic violence. They were abused by their partner, and they were then abused by the insurance company. Are we going to abuse them once again by repealing that provision? Not if I can help it. Then there were other issues, also particularly related to the whole issue of prevention. There were parts of this bill, we offered a prevention amendment. When they tried to take our mammograms away from us, the women took to the floor, the Democratic women took to the floor, good guys supported this bill, and we passed preventive measures at no cost and no deductible in order to make sure we not only had our mammograms, but that there were other preventive services. Bill after thing. Are we going to go back to that? I hope not. So if they're going to repeal, that's what they're repealing. They're really repealing the way we ended the punitive practices of insurance companies. They're really repealing our attempt to make sure Medicare was solvent and close the donut hole for prescription drugs for seniors, and also get them a better health evaluation. We also did other things. I'm so proud of this. We said to the insurance companies, 80% of what you collect has to go into health care. It can't go into administrative costs. It can't buy you another Armani suit or a set of Gucci shoes or another or third or fourth home or a $1,000 bottle of wine when you have those conferences where you think about price fixing. You have to put it back into health care. I don't want to repeal that. I want that 80% collected to go back into health care. I think that's a good idea. You know, in our bill, one of the things I'm proud of is that we stopped big insurance from putting lifetime dollar caps on benefits. I heard from a woman in Columbia who told me her husband had reached his lifetime limit. So when he needed an EKG to deal with a long-term cardiac problem, they had to pay for it out of pocket. Even with health insurance, their health care cost still topped $17,000 a year with their annual income at $60,000. By lifting that cap, the man can get his EKG and prevent other kinds of problems. I could go case example after case example. Now let's go to something called quality and prevention. I know that's often ridiculed. Oh, that's gush. You know, that's not like, that's not like real medicine. But I just want to tell the story of a brilliant and talented physician at Johns Hopkins, Dr. Pronovost. He developed a checklist to lower, that if followed, lowers infections that are caught in hospitals, which takes lives, takes money, and extends stays. In the health care reform, we improve patient safety and help prevent medical errors. The Pronovost checklist, which we allow to occur in the bill, has now, we found out, reduced in Michigan patient deaths by 10%. And it's nearly had over an 85% effective rate at eliminating bloodstream infections. The cost savings to both public and private insurance in Michigan has been stunning. Do we really want to repeal these measures that are saving lives and saving money? You know, Mr. President, I don't want to repeal this bill. We did a lot of good things in it. And if the Republicans have ideas, then I don't think they should vote to repeal unless they've got a better idea to replace what I outlined here today. So I challenge them. If you want to repeal, keep the other half of your campaign promise. Replace. Let's put those replacement ideas out into the light of day. Let's put them out for debate and discussion and then votes. I'm up to the task. I wonder if they are. Mr. President, I yield the floor.
Mr. President.
Senator from Georgia is recognized.